The District Employee Facebook Live event with the Superintendent. I'm Irma Lancaster, Director of Communications, and I will be your moderator for tonight's event. Before we get started, it is my pleasure to introduce our Superintendent, Dr. Ken Savage, who will provide the official welcome. Dr. Savage.
Thank you, Irma, and a good afternoon to our staff and to our teachers. Thank you for joining us today via Facebook Live to hopefully address some of your most pressing questions. We appreciate you and what you are doing each and every day. Your job is not easy, and it has only been made more challenging by the pace of the changing health protocols. We want you to know that we understand your frustration and we hear your concerns. As superintendent, I take responsibility for the change in health protocols. The reinstituting of the mask mandate is in my heart the right thing to do for our community and health partners at this time. I hope that the restrictions can be relaxed in 30 days, and we are working hard to analyze data trends to support a move towards a more conventional school year. Please know that we can get through this together as a district team. That being said, I will provide answers to questions that I can, and members of district leadership are also present to support in their areas of expertise.
This evening, we have Will Rothenberg, Director of Compensation and Labor and Human Resources, Dr. Amy Desmore, Chief Financial Officer, Dr. Jeff Spiro, Chief Academic Officer, and Lauren Stillwell, Chief Engagement Officer. Thank you all for being with us this evening. Now, yesterday we sent out a form and asked our employees to send in their questions for tonight's event. We reviewed those questions and we selected those prominent themes that we're going to share with our panel tonight. During the event, we have staff that will monitor the comments that are coming in, and we will identify common themes that may come in, and we will answer those towards the end of the event. We'll try to get to as many questions as possible, and we will answer additional questions after the event is over. Now we're going to get started, and we'll go ahead and start with you, Dr. Savage. We continue to get the question of why are we doing this? Why the mask mandate? So if you can just quickly let us know what the rationale is behind doing this now, and what metrics are being used to determine what protocols can be relaxed after 30 days. What happens after the 30 days?
Well, that's a great question. So the first and foremost is that we are in the midst of a surge, unlike what we have ever seen before. About a year ago in July, we did experience, after the 4th of July, a surge. And we thought that was a bad surge. And unfortunately, this surge is profoundly more so than that. And we know this because of how it's inundated our hospital system. So the hospital system has been doing a lot of communication with us in terms of where their current status is at. We also put in place all of our recommendations, mitigation factors from last year. The mask piece really was just one among many others. I want to reiterate first and foremost, before I go back to the masks, that the number one thing that our medical partners have told us to do to prevent hospitalization and loss of life, the number one thing a person can do, if able, is to get a vaccine. So the broad availability of the vaccine, so important that people who can get the vaccine do get the vaccine, and that's something our medical partners have unequivocally said is the top mitigation strategy. But however, knowing that a lot of folks have chosen not to get the vaccine for whatever reason, or maybe they don't have that available, or they may be a child 12 and under, that is a challenge. And so all those other mitigation factors work together to try to help keep us as safe as possible. And just knowing that the numbers are so incredibly high, in spite of all those other factors that are in play, the masks then became a necessary addition to that comprehensive mitigation situation. So in terms of the data for the 30 days, essentially, we're looking at 4 different metrics and continue to look at others as well. The first is the percentage of staff that are out due to a COVID-related issue, whether that's that they are sick with COVID or whether they are isolated or exposed to COVID. The second piece of data that we'll be looking at are students that are in an absentee related to COVID. So that's the student piece. The third piece that we'll be looking at is our positivity rate within our community. that gives us a larger metric that kind of addresses in our community the current level of positivity, as well as one that is probably quite vital for our community safety, and that is the hospital capacity, the hospital bed capacity over through our main provider, Lee Health. So when you put those different metrics together, both our internal metrics, the Department of Health metrics, and the Lee Health metrics, and we continue to look at additional metrics that we can include, it's through that triangulation of data that we'll be able to come to the best notion of which protocols can be relaxed at which time period, masking certainly being one of them.
Great. Thank you so much, Dr. Savage. This question could go to either Dr. Desmore or Mr. Rothenberg. Please explain why personal time is used when employees are quarantined or test positive.
So we have a memorandum of understanding in place with both the Support Personnel Association of Lee County and the Teachers Association of Lee County, which now allows for the use of sick leave for COVID purposes. That dates back to 7/1 of this year, although the MOU was recently executed and has been communicated out to employees. So if someone has a quarantine situation where they're being directed by their employer to stay home, they are able to use up to 10 days for a single incident of COVID sick leave.
But I just wanted to add to that yes, it was a memorandum with both unions, but it does apply to all district personnel. So regardless of what employee class you're in, if you have a situation where you're COVID positive or directed by your employer to quarantine, then yes, you would receive up to those 10 days for a single incident.
Now, for clarification, the follow-up question was for new employees, so would this also apply to new employees?
Yes, this would apply to all employees up to 10 days for a single incident where there's an employer-directed absence due to COVID-19.
Thank you so much. This next question could go to Ms. Stillwell. What is the staff notification process when exposed to a COVID positive case?
Sure. So the process is fairly the same as for students. We will get notification of a positive case that will be sent in most of the time by the COVID incident reports that we collect. That goes to our COVID command center. Then the schools send the close contact list to us, so that's anybody that's within 6 feet for 15 minutes or more. And once we get that from the school, we send it to the DOH. The DOH does a quick case investigation. They look that over. They will send us back the list of exposures, and then we will notify who those folks are that are exposures. I do want to also say something, though, that where things get, it sounds like an easy process, but there's a lot of complicated steps along the way, and one of the most controversial, or not controversial, but one of the ones that is the hardest for us to deal with is the home testing, because now home tests are really out there and prevalent, and so people are doing these home tests. But if, per the Department of Health's executive order, if someone is doing a home test, it has to be a home test that is either A, reported to a laboratory, B, reported through a mobile app, or C, done with a medical provider. So a lot of these home tests aren't one of those, and so in cases like that, sometimes we're getting notified of a test, but if we can't confirm that it's a positive test, then that means, or the DOH, it's not reported to them, then they can't quarantine because they cannot isolate because they can only do that based on a positive test. So so that's really where our challenge is right now, is that if it is a home test, if we can't get that confirmation through the DOH that it's a positive, then we can't quarantine. So that's kind of where we are, but that is the process.
That can lead into our next question. Has progress been made on the delay in notification? And is that from DOH? Is that from us? What's going on exactly?
Sure, so it's both. And I will say that, we, at the beginning of the year, and I didn't get an updated count today, but, at the beginning of the year, within the first 14 days of the school year, we had almost above 6,000 CIR reports. In the first 4 months of last year, we had 10,000. So we basically had more than half in 14 days of what we had in the first semester of all last year. So that has put us behind as a district. So it is both, it's, I know people are are quick to look and say that it's the Department of Health, but in all honesty, it's us too. And we are working to hire more staff in the COVID Command Center to be able to process those forms faster. And there's a lot of things that we're doing, and great part to Dwayne Altman, our IT side, and Daryl Eldon, to make that CIR form process a lot faster as well, so that we can get with the DOH a lot more quickly and process those forms so that the notification becomes more streamlined.
Great, thank you so much. This question could go to Dr. Spiro. How is the district helping to alleviate staffing shortages due to quarantines?
Well, thank you very much. First off, I appreciate everybody tuning in and listening tonight. Our number one job is to support our schools. We know you are the front lines and you are dealing with the crisis on a daily basis. And so our job at the district is to provide as much support as we can. So what does that mean? So our principals that are on Facebook Live, they know this process already. What normally happens is our principals will contact their executive director the night before school begins or the morning of before school begins to let him or her know that they are short X number of teachers and a particular subject areas that they might be short in. We then redirect our certified staff to go out and support those schools to make sure that classrooms are covered. We know that classes are doubling up, teachers are giving up their planning periods, there's a number of mitigations that are happening in the school, and we want to be part of that solution, and so our principals work directly with the executive directors to do that. The other way we're supporting schools as well is with our Connect with Lee program. Starting next week on Tuesday, we're going to have Connect with Lee during the day, and as a reminder, Connect with Lee is our homework help. Last year we did that at after hours for kids who were home on their Google Classroom. They were able to Zoom in live with the teacher to get the help that they need. This year we're expanding that to have Connect with Lee during the day, where district staff will be providing live Zoom link help to students that are home so that they can get their questions answered as well. So we help cover classes, and we're helping to provide content support for students when they're home.
Now, these questions are actually just coming in, but they could be related to this, and it could either be you, Dr. Spire, or you, Dr. Savage. What is the status of Lee Home Connect, and is there a possibility it could return?
So I'll be happy to answer that question. So we do not have the authority right now to provide Lee Home Connect to our students. Last year we were given through the executive order, we were given that opportunity to do an innovative learning model. Unfortunately, we don't have that option for us. And so the options that are available are all the ones that we've provided to our students and their families. We have face-to-face, we had Lee Virtual, which was a full-time virtual program, a virtual option for our students, and of course homeschool, and then there's homeschool with FVLS Flex, which means the student can be enrolled in homeschool and at the same time take 1 or 2 FLVS courses as well. And those are really the only options we have. I wish, with all earnest in my heart, that we were allowed to provide other opportunities for our families specifically, and we just cannot do that at this time based on the current parameters provided to us by the Department of Education.
Now,
if I could just add to that, though, real quick, but that just because there are certain pieces we can't do, we're really also trying to supplement. So there's some great things that Dr. Spiro and his team are working on to try to continue to find enhancements. And so, Dr. Spiro, do you want to kind of talk about the supplemental piece that your team is already providing after hours and some of the work they're trying to provide during the school day, just so that families can receive that additional support system virtually and safely, but really just trying to fill the gaps within what we can do. Do you want to talk about that for just a second?
Sure. Thank you, Dr. Savage. And this is what I was talking about previously when I answered the last question. Connect with Lee. Again, remember, that's a homework help opportunity for our students. That is an opportunity to them engage with a certified teacher. That's available in the evening, after hours for when students go home, and again, during the school day. So as you're teaching in the classroom and a student has content questions, they can reach out to a district staff member who will be live on a Zoom link, and we'll be able to help redirect that student academically so that he or she can continue with their schoolwork and the learning doesn't stop. Hence the importance of keeping the Google Classroom up to date so that students, whenever they are home, can have access to classwork and their homework as well.
Now, we are being asked specifically about the status of Leave Virtual School, since that is an option that hasn't been available before. Is that at capacity? Is that just not available at this time?
Leave Virtual, at this very moment, Florida Virtual School for full-time is not available for students. Leave Virtual School will become available for students at the semester when that reopens again. We had extended the date for Leave Virtual School to go past the first week of school to allow families to make that choice for their students. Because of seat time at this point in the year, we're unable to reopen up the Leave Virtual School.
All right, now we're going to go back to Ms. Stillwell. What is the decision process on when a classroom is quarantined?
Sure. So mainly what we'll take into account is the number of students that are positive and then the number of students that are exposed. So that is really a conversation between the DOH and the COVID Command Center. When we have 1 or 2 positive students, we notify the DOH in a classroom, and then the DOH will look and do contact tracing immediately. And especially in our younger grades and some of our ESE classrooms, it's really hard to keep all those students apart anyway, and so that will go into the factor of making the decision to quarantine the classroom. But if we do know that we have, the ability to social distance, and we have kids that weren't within 6 feet and all of that stuff, we'll do everything that we can to keep that classroom open. But it's a discussion really with the COVID Command Center and then guidance from the DOH as to how many kids we need to quarantine at one time in that class.
Now, it sounds like there's a lot of confusion still on how it's decided who's quarantined when it comes to vaccinated and unvaccinated staff. Why is it that vaccinated staff are cleared to return to work immediately or in a different way than unvaccinated staff?
Yes, so thank you. And I'm going to refer to my notes because I actually just wrote this answer to somebody earlier. So it all comes down really to the Florida Department of Health's emergency rule. That emergency rule states that students who are fully vaccinated are not subject to quarantine as long as they're asymptomatic. And then CDC guidance basically says that any of those who are fully vaccinated do not have to quarantine. However, the CDC did update its guidance that they do recommend testing. So if you are fully vaccinated and you're exposed, the CDC recommends that you go get tested to see if you're positive, and at that point, the positive protocols would kick in where we would want you to stay out. But at this point, under the Florida Department of Health's emergency orders for students, we are not allowed to keep them out if they're fully vaccinated and exposed.
And our staff has been made aware of all the protocols and the process. Where can they find this information if they missed it?
Yes, so we have multiple, thanks to Laura Howard, who's in the audience, multiple locations on our website, leeschools.net, where we can find those protocols. There is a rotating banner at the top of the page that you can click on to see that, and then also if you scroll down kind of to the middle of the page, there's a static image, and under that image is COVID protocols, and you can go there as well. And there is a flow chart for students. And then it's very similar on the employee intranet page, where if you click employee portal on the home page and you use your credentials to log in, then there is also that same information on the employee page, and there's the flow chart and everything else that's there too.
Great. Thank you so much. This next question can go to Mr. Rothenberg or anyone else that may have the answer. How is the district handling staff who object to the mask mandate?
I would start out by saying, first of all, I know we're one day into the mask mandate, and early indication is that staff are complying with the superintendent's directive, that they recognize that although this may not be desirable, it's what's necessary for the health, safety, welfare of student, staff, and our community. In situations where an employee may have an issue with wearing a mask due to medical reasons, they are able to request an ADA accommodation where they're required to provide medical certification. There's a process where there's an individual review and assessment about whether a reasonable accommodation can be provided to the employee and what that reasonable accommodation would be. I know that there have already been a number of those requests submitted and that they're being reviewed in an expedited manner. To give some context, in a normal year, we receive about 20 of those. Last year, I believe we received 400. The processing of that takes time, but there are dedicated staff that are trained in how to respond to those requests, that are responding to those requests. In situations where it's simply, someone refuses to comply with the directive. I think the first step is the site-based administrator should be having a conversation with the person, looking at support and assistance. If it's a situation where a person, has forgotten a mask, doesn't have one available, obviously that's treated differently from a situation where someone is refusing to follow the directive. Progressive discipline would apply in those situations where there's insubordination, and there's a whole process for that outlined in both of the collective bargaining agreements. And again, that's well-worn territory that allows notice and the opportunity for the employee to respond.
Now, what support is being provided to staff to manage situations on campuses where students may not be wanting to wear a mask? What is the protocol?
I'll go ahead. I'll be happy to answer that question. So if teachers are having issues with students who are refusing to wear masks, certainly you don't want to get into a power struggle with that student. You ought to go ahead and report that to your child's principal. Let your administration handle that. Let them talk with the parent. Let them talk with the student. You go on and worry about the teaching and learning of the day, and let the administration handle those particular complexities around masks.
Thank you. I believe this one could go to Dr. Savage. We have received this one actually several times on Facebook, and you may have heard it before. Will district staff be required to be vaccinated?
Well, the current situation for us is that we want to make that vaccination broadly available. And that's not just because we, as educators say it. It's really, this is from a medical perspective, from the medical experts, both in our community and across the country. The guidance is that the best way to prevent death, hospitalization, and the most serious consequences of the COVID exposure is to get the vaccination. We recognize that not everyone can get the vaccination. Certainly children 12 years age and under, as well as folks who have medical conditions that do not allow them to have that vaccination. But for everyone else, it really is strongly encouraged, as it is the best way to keep themselves safe from the most severe consequences of it. But this time, it certainly is not required of employees.
Now, if a staff member is aware of a case or exposure that perhaps happened off campus, but they know that person and that person didn't report, is there a process for maybe say, I know about somebody that was exposed and they're still there, to communicate that to the school or the district of that awareness? Would that maybe for no current process?
No, there's no current, I mean, I think we're relying on folks to, to let us know when they have been or when there is a positive case. There certainly would be a way maybe to call the DOH and let them know through that, would be my suggestion in that situation.
Great. Okay, thank you so much. Well, those are all the questions that we're getting, the common themes that we're seeing. So we're going to wrap up shortly, but before we do that, I want to make sure that we remind everyone that this live video will be available post. So if you missed it, you can catch it anytime on our Facebook and our YouTube channels. So I want to make sure families know, and families can also add questions there. This event was specifically catered to our employees. However, we always welcome questions from anyone out in the public, and we're happy to follow up on any comments that come in after this event. Now, before we wrap up, Dr. Savage, do you have any closing remarks?
Well, sure. And just if there are questions that weren't answered here and so forth, we have our online resources. We also have our COVID hotline that handles just tremendous work. They get all manner of different types of questions that come in. We just recognize that it's a very trying time for everyone. So first, before I do anything else, I just want to thank everyone sitting up here that was here to answer questions. This is just a small representation of the staff that has really worked tremendously hard to try to respond to such a difficult situation and try to come up with creative and thoughtful solutions to what has really become a very dynamic and extremely difficult process. So a big thank you to the team that's up here at the table, as well as our pandemic team and the many just elements of staff who've supported their work every single day. It's just a whole all hands on deck approach to do that. I also want to just say to those staff that are watching, I've been personally going out to visit schools to see firsthand, and what I can see already is that people are already exhausted. And if you think back to a year ago, we were just opening up school a few days earlier than we are right now. We opened up on the 31st of August, right after a gigantic summer surge. And we thought last year's surge was bad. This year's surge is so much worse. And we opened school during that surge. And so we really had a chance to be experiencing the very worst of this. If the surge that we are currently experiencing models out very similar to other surges that have happened throughout the life of the pandemic, it will have an end. I can only hope that it ends as soon as possible, but just know that we're in it right now, and it's very clear that we're in it. And so I just appreciate all the sacrifices that you as staff members have had to make to address this horrific time period, whether it's teachers covering classes, whether it's cafeteria staff having to go to other schools, whether it's custodians having to go to other schools. It's been all of us, one district coming together to sacrifice so that our kids can go to school, so that our community can keep moving. And we're doing so to try to put education first, knowing that education has been so substantially interrupted. We're doing it in a very hostile political time period where the decisions are controversial, and we're balancing all of that. And the people who are balancing it are you, our workforce. So from the bottom of my heart, I want to thank you for the sacrifices you've made for our community, for the families that depend on you so they can go to work every day, so the children in your care can learn and can be fed, and that our facilities can be maintained, our buses can be moving. I just thank you all for your contributions to make this district go, and I can't wait until the end of this surge event. So just thank you for all your sacrifices. Thank you for the sacrifices you will continue to make in the interest of public education. Thank you very much.
Thank you so much, Dr. Savage, and thank you so much to our panelists and our employees who are here in the audience, and all our employees that joined us for this live event. Remember, you can continue to send questions and we'll answer them as best as we can. We look forward to hosting more events like this throughout the year for both families and employees, and looking for ways to continue to enhance our communication with everyone. So we appreciate you joining us. Have a great evening.